Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.
Welcome to St. Louis on the Air. I'm Sarah Fensky. Across the St. Louis metro, many businesses have now reopened. That's also the case for many restaurants. But the coronavirus is still here, and so being open doesn't mean being open to everything. Gerard Kraft is the James Beard award-winning chef behind the Niche Food Group. His restaurants include Sardella, Pastaria, and Brasserie. He explained the new procedure being required at his restaurants to our producer, Evie Hemphill.
When you come to our door, we ask that you have a mask on. So come in, and if you don't have a mask, we will provide you with a disposable mask as well. You are taken to a table. Your tables are all at a minimum of 6 feet apart from any other table. All of our employees will be wearing masks. You'll get a little bag that has kind of QR code for our menu so that you can kind of get on your phone and look up your menu. If you request, we can give you a disposable menu. And once you're at your seat, you can take your mask off and enjoy your, wine and food and have a great dinner feeling safe. But we do ask that if you get up from your table to go to the bathroom or anything of that nature, that you just put the mask back on. And we provide you with a little bag to keep your mask in while you're at your table. It's really, it's funny, even as I'm saying it, I'm like, why is this so hard? Like, this is not a big deal.
That's restaurateur Gerard Kraft of Niche Food Group. But while wearing a mask might not seem like a big deal, to some patrons it is. Gerard Kraft explained.
This seems to be an issue everywhere. And it seems to me that masks have kind of become a political statement, which I think is kind of terrifying because they're so important. So our experiences really have just been that, certain people just get angry about it. And it's kind of a weird, irrational anger, because obviously they don't have to eat there. They can go choose to eat somewhere else. Sometimes it's almost as if they want to get mad about it. So it's almost as if they're coming in knowing that they're going to have to wear a mask, and then I just want to be angry and throw a temper tantrum, which is kind of bizarre.
And that's Gerard Kraft of Niche Food Group. And it's not just his restaurants. St. Louis-based rideshare driver Bob L. is experiencing the same thing. He told us earlier this week what he's seeing as he drives for Uber.
I've had a few interactions, mostly over this past weekend, with passengers who seemed completely oblivious to the existence of COVID-19 and the precautions that many of us are taking. Just for a little bit of background, Uber currently requires passengers and drivers to wear masks at all times. Whether all drivers are enforcing that or not, I can't say, but I'm guessing not all drivers are. So, it's been difficult, especially when there's someone who doesn't have a mask with them. In those cases, I do have a few extra disposable masks that I keep on hand. But, that's not a long-term solution for me. I have lost a few rides, but honestly, I don't look at it as losing rides. I look at it as, I'm not risking my own personal health to make $20 driving someone from one bar to another.
And as rideshare driver Bob L. explained, being tasked with enforcing masks isn't easy.
The hardest part, I think, has probably been just explaining to passengers the concept of, I wear my mask to protect you, you wear yours to protect me. And for the most part, once I explain that, they're fine with it. But there are a few who, maybe they're not, maybe they've had a few drinks, and they get a little bit belligerent, but in those cases, just end the trip or cancel the trip and move on to the next one.
And that again is rideshare driver Bob L. Now, Bob has made his peace moving on, but what about us as a society? That question has been weighing heavily on Michael Rozier of late. Father Rozier is both a Jesuit priest and an assistant professor of health management and policy at St. Louis University, and he joins us today. Father Rozier, welcome to the show.
Thank you for having me, Sarah. Good to be with you.
Now, you tossed off a tweet about this issue last week. You wrote, "Sadly, I'm becoming convinced that COVID is not far from taking on the characteristics of gun violence. The U.S. will endure much higher, persistent negative effects from something that other countries have solved. We'll normalize it and convince ourselves nothing can be done." What led you to that moment of seeming despair?
That is a great question. This is sometimes what happens on a random Thursday night when something pops into your head and you decide to make it a tweet, and it has gone off to the races. I think what motivated the tweet was kind of being out and about or talking with people, and for the most part, my friends and family are very cognizant, aware of what's going on, but there seem to be a pretty sizable number of outliers in our community who are either resistant to these new social norms that people have broadly accepted, and people are frustrated about how to deal with that reality.
Mm-hmm. So you put this tweet out there, as you say, it was just kind of in this moment, you're feeling this. What kind of reaction did that tweet end up getting?
Largely positive reactions. I think it did resonate with people that people sensed that this is going to be with us. The virus is going to be with us for the foreseeable future, and people really want to figure out how to live well during this time. But the thing is that we can't live well all by ourselves. We live in a community and a society, so we depend on each other to live well. And I think that's what resonated with people.
And you heard earlier, Gerard Kraft, the restaurateur, Bob L., the Uber driver, they really are getting pushback as they try to enforce these norms. What do you think needs to change in order for this situation to change?
Yeah, I would point to a couple things. So in public health, behavior change or creating new social norms is a whole area of study. And when we look at human behavior, we look at the cognitive factors of that. Do people know what's going on? What's their attitude toward it? We look at kind of behavioral factors. Do people have the skills to do something well? And we also look at environmental factors, which would include, access to the materials you need, but then also the social norms that we're talking about. And so in order to kind of move the public perception on this, a couple of things come to mind. One, access for, I think for a long time, it might have been difficult to get masks, or they might not be fit well or be as stylish as people want. I also think the social norms that having leaders, whether it be political or religious or business leaders who fall on the non-mask wearing side and kind of make it a political point or something like that, certainly doesn't help. And I think it all might be a little exacerbated by media that really thrive on kind of division and discord, because the bottom line is the majority of people believe that this is the way we need to proceed. And so it's a matter of kind of continuing to build momentum toward greater consensus.
It is interesting. It does seem to be becoming political, that maybe people who feel allied with one political party or watch, say, one particular news channel on cable, that they are feeling like this is something that's baloney, and it's kind of become a talking point. How do you deal with that when, on the other hand, there's a lot of people in the media saying, you got to wear your mask, but not everybody's listening to the same media or watching the same media?
Mm-hmm. Well, if I could solve that problem, I would be in charge of a whole lot more things, probably. But I think a lot of it does come down to relationship. So I think a lot of change happens at that individual level as well. As we heard, an Uber driver kind of explaining why we do this thing for each other, or a restaurateur explaining that no, this is to keep everybody safe, so you actually can enjoy your evening. Because I think ultimately what we're all kind of longing for, and the people who are resistant to it are longing for some sense of normalcy. And so what we need to, I think, try to collectively do is to figure out how can we do the things, whether it be socializing or going out for a bite to eat or a drink. How can we do those things within this new normal? And I think that's kind of what motivated the tweet as well. Can we start putting our energy into creative solutions for all of this stuff, rather than putting our energy into sowing division? Because I ultimately still am hopeful that we can figure all of this out together.
You had pointed to gun violence as sort of the worst case scenario. If this just becomes a normalized thing where we kind of give up on solving the problem, it seems too intractable. Can you point to something where there's a social norm where public health has been able to change people's minds on it, and something that's no longer accepted that once was?
Yeah, I mean, I would say the most prominent example would be smoking. It was not too long ago that the social norm was the exact opposite, that whether it be in airplanes or restaurants or in movies that you were watching, smoking was a broadly acceptable behavior. But through efforts of both changing the informal norms, but then kind of formal policy, we have, I think, shifted that social expectation. Now, the challenge, of course, with COVID is that we don't have decades to do this. Mm-hmm. We literally have weeks to help shape this norm, which is an admittedly much taller order than we have done in other public health efforts.
Yeah, when you put it that way, it seems like time is just not on our side with this one. California and Texas, they're already seeing huge spikes. Are you worried it's too late?
I'm not. I do think it's going to take a more concerted effort, but no, I don't think it's too late, because the areas that we're seeing spikes in right now were the areas that didn't see that initial surge in the way that the New York or Detroit areas saw early on. So I think the lived experience of people actually makes a difference. And so as we're thinking about kind of the building of social norms, we often point to the frequency with which we see something, or the consistency which we see something. And so I think over time that is going to help. But it's also going to take people in positions of authority modeling the kind of behavior that we all are asking of each other.
Mm-hmm. We're talking to Father Michael Rozier. He's a Jesuit priest as well as an assistant professor of health management and policy at St. Louis University. And we do want to invite you to join the conversation. What do you think is driving the animus against mask wearing, and what will it take to change it? Give us a call at 314-382-8255. That's 382-TALK. Or you can send us a tweet at STL on air, or email us at talk@stlpublicradio.org. We need to take a quick break, but we'll be back shortly to continue this conversation. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.
And now back to our conversation. We're discussing the social norms of the pandemic with Michael Rozier. He's a Jesuit priest here in St. Louis. He's also an assistant professor of health management and policy at St. Louis University. I'm going to go to the phone lines here in just a moment, and I do want to invite you, if you're interested in this conversation and have some insight into why are people not wearing masks, what will it take to change that, you can give us a call, 314-382-8255. That's 382-TALK. On the phones, let's go to Cole. He's calling from Troy. Cole, hi, you're on St. Louis on the Air.
I appreciate you taking my call.
Yes, thank you for joining us. What's your perspective on this?
So I am, just a little background, I'm politically very conservative, but this is 100% not a political issue. I feel like conservatives, more than people that are more progressive, are turning it into a political issue, and I absolutely don't understand that. I do know that there was mixed messages in the beginning on whether masks would be helpful or not. But I think by now we all know that it is certainly better to wear them than not to wear them, and I just don't understand why people. I understand the frustration, the need, and unpleasant and all that, but to actually not bother to wear them, I truly have struggled to understand.
Cole, have you tried to persuade some of the conservatives that you're hearing this from to come around to your point of view? I'm curious if you've had any success.
Yeah, I'm a production worker. I actually split time between Troy and Cape Girardeau. I work for a Fortune 500 company in production, and we have to wear them all 12-hour shifts. We have to wear them the entire shift. And people are always whining and complaining about it. But when you really get down, if you can get them into a heartfelt conversation instead of just a reactionary conversation, you will be able to convince people that, yes, it just makes sense. It's a pain in the butt, but it makes sense.
Well, Cole, thank you for that. Father Roger, what do you think in light of Cole's experience here? It's interesting that his one-on-one proselytizing does seem to be working.
Yeah, I think Cole makes some excellent points. First, that kind of early in the pandemic when we were worried about PPE for healthcare workers and the fact that we didn't know exactly how the virus was transmitted, that there were some mixed messages early on, which could lead to some confusion, and that idea that the personal relationship, the individual conversation is really the kind of place of encounter. I think both very good points. And, the kind of general, I think, desire politically on the conservative end is that that we not be limited in our actions, and a great way to kind of frame this is that has some limitations itself, that we are limited, but we have to prevent harm to other people. And so insofar as we can prevent harm to other people, that's a reasonable ask, I think, of people in society.
I actually saw a study. This was by the Institute for Health Metrics and Evaluation. Their model suggests that mask wearing could save as many as 33,000 American lives over the course of this pandemic. It feels like if that model holds up, that's a statistic that can be somewhat persuasive.
Yeah, I just saw that study as well, and some really good work coming out of the University of Washington on that modeling. And I think we can also look back. Actually, there's a study in a journal called Health Affairs that was published yesterday that basically showed in the natural experiment of where masks were mandatory and where they weren't, we can look back and see a pretty significant reduction in the transmission of the virus. So it's not just about kind of looking forward to seeing what can be done, but looking back on our policy experience and to say, actually, this has worked in other environments.
Let's go back to the phone lines. Michael is calling from St. Louis. Michael, hi, you're on St. Louis on the air.
Hello. One of the observations that I've made as I've kind of traveled, into St. Louis and out of St. Louis, so into more rural areas, is that mask adherence seems to be has become a political issue. And as you go into more conservative areas of the state, you can see the adherence dropping to zero. And one of the things that baffles me is I identify as conservative. The choice to wear a mask seems like something, individual freedom and liberty that I would want to do if it has any measure of protection. And I don't understand the mindset in some areas that to avoid wearing what to me is basic safety equipment, or how basic safety equipment became such a politicalized issue.
Yeah, Michael, thank you for that thought. And I actually have heard from a number of listeners, some on Facebook, who noted that they see a big difference between the urban part of the state here in the city and then out in the outstate areas. Do you think that in addition to possibly the political things we're seeing here, that this is also an urban-rural thing, that maybe people in smaller towns don't feel that there's more space between them in general, and so this doesn't feel as necessary? Father Roger, I'm curious about your thoughts on that.
Yeah, I actually am from rural Missouri. I'm from St. Genevieve originally and still have a lot of family and friends there. So I think a couple of things might be coming into play, that the virus did hit harder in urban areas early on. Now we're seeing the rise in rural communities, and so that might kind of make a difference in terms of people's kind of social expectations of each other. And I also think in rural communities that there's a sense of knowing one another, and that familiarity can be a good thing most of the time. And in this situation, it might be kind of a challenging thing that we want to presume the best about people that we know, and therefore, I haven't heard that so-and-so's positive in the way that you might not know when you go into a Schnucks or somewhere like that in an urban area and you don't know everybody. And so I think there are probably a couple factors beyond maybe the political ideology that are at play there.
That's an interesting observation. I'm glad we have you here to speak to that that background. That's not my own background, and so it's always good to learn about others' experience and what you saw there. And Michael, I want to thank you for that call. Let's go back to the phone lines. Tammy is calling. I guess she's from just outside St. Louis. Tammy, hi. You're on St. Louis on the air.
Hello.
Hi. Thank you for joining us.
I was just going to add to the conversation that I am 61 years old, and, when that seatbelt law came out, I was frustrated. I was really angry, that the government was going to, step in and make a law, where I had to wear a seatbelt, although it was for my safety and for my children's safety. And, of course, I wouldn't get in the car without one now. But, at the time, it was really frustrating, that they were wanting you to do something like that, And I think that the Republican Party in general, I don't think that they want the extra government control, like, wanting you to wear the mask. Now, I wear the mask wherever I go, but I kind of am independent, as far as, being a choice of Democrat or Republican, But I see the importance of it. I have a cousin in she just she's very adamant. I'm not wearing it. But I think it's a combination of things, that she's Republican and, she's very strong in her belief that, extra government telling us what to do.
That's, Tammy, yeah, I can absolutely see that point that several of these variables might be influencing people's politics on this. Father Roger, I'm wondering about the change on seatbelts. It seems like a good example that back in the day, people maybe felt like the government was getting inside their car with them, telling them what to do. But now it's certainly very accepted that we have to wear these. Do you see a parallel there?
I do, and I think Tammy's comment brings up a really important distinction between kind of informal social norms and formal public policy. And so that's I think the debate right now is I think we would all prefer less regulation or less kind of formal policy in our lives. And so we won't have to move to the place of formal policy if we can adopt kind of more informal social expectations that are broadly shared and adhered to. And so, the seatbelt obviously was that formal policy, and we have done that certainly in public health over different issues. But I would prefer, and I think most people would prefer that. Rather than the kind of mandates and a heavy-handed policy, if we can achieve it in an informal way, that's certainly preferred. But if we can't do it in an informal way, then we're likely going to have some kind of imposition of a regulation or a policy to make this public health good achievable.
I want to go back to the phone lines. Brandon is calling from Wildwood. Brandon, hi, you're on St. Louis on the air.
Hey, how are you?
Thank you for joining us today. What's your thoughts on this issue?
So I think one of the main problems that we're facing is that a lot of people just solely get their news from social media now, and they're taking this information that's being shared by these social influencers who don't have any regulation on what they post out. So when they post these things, their fan base trusts them to tell them the truth. And when they post this information about how masks are bad for them and how masks don't really help, it creates this spread of misinformation that's really hard to deal with, where people just become believers in this information that may or may not be 100% accurate.
Brandon, I think that's a great point, and thank you for that. I want to go to Sam, who's calling from Warrenton. Sam, hi, you're on St. Louis on the air.
Hello, how are you this afternoon?
Thanks for joining us. How are you feeling about masks?
Well, I moved from an urban to a rural area, so I talked to a lot of rural folks around me, and it seems as if when Dr. Fauci decided to encourage mask wearing, it seemed like so many people around Troy, Missouri, and Warrenton, Missouri, would adhere to that. As soon as it became politically divisive, things changed, and I've actually stopped a couple people just to ask, if why they aren't wearing masks, and not in an aggressive manner, but two of those were EMS workers with children at a local Walmart, and they said, there are a lot of things out there that are far worse than this. So I see it as like an untouchable, unseen kind of thing, and with the divisiveness just in society right now, I see it being worn as a political statement, or not worn, I should say.
Mm-hmm. Sam, that all does make sense, and thank you for sharing that perspective. Father Rozier, any thoughts on those last two callers?
Yeah, so I think Sam makes a great point about the unseen reality of this, and we can see this going on in Texas and Florida right now. So the governors just today announced that they are shutting down bars, they're rolling back restaurant capacity, and unfortunately with this virus, there's a several-week lag until we see the effects of our behaviors. And so there is this kind of unfortunate reality that we don't see the negative effects of our behaviors until it's almost too late, which is why it's so important, even if we don't see the kind of hospitalizations and mortality rates, that we still kind of stay consistent with these behaviors, because it'll prevent those things from happening in our communities.
Now, earlier in the show, we played some audio from Gerard Kraft, who's a pretty big deal restaurateur here in town. And when he talked to our producer, Evie Hemphill, he explained that, everybody says, what can we do to help restaurants during this time? He said, if people don't follow these norms, this is what's going to kill restaurants, that all these restaurants are teetering on the brink right now. And this is, there's a simple economic argument here that people need to do this just to help their favorite eatery stay in business. Do you think we'd be more successful framing the argument in terms of economics as opposed to trying to rely on people's altruism? Father Rozier, any thoughts on that? Okay, we may have lost our guest here. I'm so sad. I was definitely enjoying the conversation with him, and I think we might have had a technical difficulty. I'm going to take one last call, and then we're going to need to move to our next segment. Derek is calling from St. Louis. Derek, hi, you're on St. Louis on the Air.
Hi, thank you for taking my call. I appreciate it.
Yes, thanks for joining us.
Absolutely. I also come from a very conservative family, although me, myself, I'm a little bit more liberal. And one of the things that we hear a lot in conversations with my family is about not wanting our rights infringed upon, being able to have all of our rights. And for me, where a lot of this comes from is basic misunderstanding of what our rights are. As private businesses, it's their private property. They have the right to require whatever standards or regulations that they want. And I've witnessed so much of not just my family, but people at stores wanting to, fight that because they believe it's a rights infringement, which it is not. Private property and privately owned property can require whatever rules they decide for their business. And I think a lot of this just goes down to the basic American public misunderstanding what their rights are that are given in the Constitution. And I think that's where we get into a lot of trouble. And then it becomes more of a political issue where we feel like we're standing for rights that we technically don't have as private citizens once we enter public property. Okay. Private property.
I think you make a lot of good points there, Derek, and thank you so much for that analysis. Father Rozier, I understand you are now back.
I am. I'm sorry about that. I don't know what happened.
Oh, trust me, it happens all the time. This is what happens when we have to rely on phone lines and can't have people in studio. But this is our new social norm here, so we have to follow through on it. I did have one last thing I wanted to share with you, and this one came in through Facebook. And Mary is responding to your tweet, and she says, "I love this show." Well, thank you for that, Mary. She says, "I disagree, however, that people have given up on gun violence. Moms demand action for gun sense in America is alive and active in many parts of Missouri. We have at least 17 active active groups in the major cities, but also Joplin, Cape Girardeau, Maryville, Central Missouri, etc. She adds, we supported Cure Violence in St. Louis and interact with legislators and candidates regularly to impact our state's gun laws. Father Rozier, is there maybe a bit more optimism in the long run, knowing people haven't given up on these issues? Gun violence is even still on the table.
Absolutely. I think that's an excellent point. And, when you try to put together an analogy, there's always going to be some misalignment, and I think she's pointed out a great one. And that's also why I haven't given up hope on our response to COVID. Like, I still have, the hope that we can figure out these new social norms and figure out how to live this really well until we do have the fortune of having a vaccine or really effective therapeutic treatment.
Well, I hope your faith in all of us is warranted. And I've really enjoyed having this conversation with you today. So, Father Michael Rozier, thank you so much for joining us.
Thank you, Sarah.
And Father Rozier is a Jesuit here in St. Louis, and he's also part of the faculty at St. Louis University. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.